Welcome everyone, and thank you to those joining us live and for those listening in afterwards. I'd also like to warmly welcome our guest today, who I'll shortly introduce. My name is Chris John. I'm the FIP lead for the COVID-19 Digital Event Programme 2022. I'm also the FIP lead for Data and Intelligence and FIP Data and Intelligence Commission Secretary. I'm a UK registered pharmacist. FIP's vision is a world where everyone benefits from access to safe, effective, quality and affordable medicines and health technologies. Our mission is to support global health by enabling the advancement of pharmaceutical practice, sciences and education. We're pleased to be delivering this event, which is episode number 4 of a programme of 7 events of our COVID-19 programme. Pharmacists and pharmaceutical scientists continue to have an important role to play in the continued response to the COVID-19 pandemic, as well as preparing for future pandemics. FIP is delivering a digital event programme, which is called How Has COVID-19 Changed Us? Pharmacy and Pharmaceutical Science Perspectives. The programme is, as I've said, composed of 7 episodes that will focus on therapeutic advances, and changes and developments across practice, science, workforce, education and policy. Preparing for future pandemics is also a key focus. So this special webinar program events will be delivered from April to November this year. Today, as I've said, it's the 4th digital event in the program, and this event is to update pharmacy professionals about managing workforce demand in a pandemic now and in future. Case studies will be presented from countries across the globe, and this will address how we ensure continuity of workforce supply during this and future pandemics, and how we can reduce demand on the workforce in this sort of situation. So the aim is to present to attendees approaches for managing workforce demand in a pandemic. The programme today, I'm briefly giving you a welcome introduction now. We will then move into our case studies. I'm delighted we have some very esteemed and experienced speakers from South Africa, Nigeria, Jordan, and Germany. We will finish with a summary and close in about an hour's time, just over. The learning objectives for today are to discuss how continuity of workforce supply can be managed during pandemics, to discuss how demand for the pharmaceutical workforce can be reduced during pandemics. We may also consider how the pharmaceutical workforce reduces the demand on other workforces, as we have seen with pharmacists delivering vaccinations. To describe the impact of COVID-19 pandemic on the pharmacy workforce, and to explain how pharmacists can be prepared for the role of vaccinator. Some quick announcements before we get going with our speakers. This webinar, as I've said, is being recorded and live streamed via YouTube. The recording will be available on our website. That's www.events.fip.org. You may ask questions using the question box provided, and our speakers will do their best to answer those questions during the event when they're not speaking. You're welcome to provide feedback on this or indeed any other FIP event to webinars@fip.org. Please do join us at FIP as a member. You can become a member by visiting the FIP website, and the address is there where you can get full details on registering. So without further ado, I'm delighted to welcome our first speaker from South Africa, Dr. Mariet Eckstein, who is Professional Development Officer at the Pharmaceutical Society of South Africa. Mariet is also an elected member to the South African Pharmacy Council, Project Management Officer for the Independent Pharmacy Emergency Fund, and is FIP Global Lead for Advancing Integrated Services, which is FIP Development Goal 7. And Mariet is often speaking for us at FIP, so we're very grateful for her presentation today. So the floor is all yours, Mariet. Thank you so much.
Good afternoon, good morning, good evening, colleagues, and thank you very much for this opportunity to spend time with you this afternoon. And we discuss a very, very important topic, which is managing workforce demand in a pandemic. And then the crux of it, the matter is not only today, but definitely focusing in the future. So thank you for the opportunity, and I'm looking forward to spending this time with you. So if we move to the next slide, in terms of managing workforce, so during the COVID-19 pandemic, so at initial glance, and I believe most of you will agree with me, pharmacy was seen as an essential services provider, which in essence doesn't sound as if there's any problems related in pharmacy when it comes to workforce during a pandemic. So we were, specifically in South Africa, but I believe around the world, allowed to operate or to continue our operations and remain open during especially the level 5 or the hard lockdown that we referred to during March and April of 2020. However, in South Africa, we saw specific industry-related changes. In other words, in community pharmacies, we saw a reduction in operational hours. So pharmacies closed early in the afternoons because a very strict curfew was in place during that time, and workforce should be allowed to travel back home within this curfew hours. Then also in private hospital pharmacies, we saw a very strong trend where outpatients with chronic prescriptions that they normally obtain from a hospital pharmacy were referred to the nearest community pharmacy in order to keep patients and outpatients out of hospital settings and to avoid the spread of infections. In our public hospital pharmacies, we saw that they issue multiple months stock at every single visit in order to decongest facilities. If we move to the next slide, you will notice that in terms of, as a result, the above impacted on the demand for what we call in South Africa locum pharmacists, or in other countries you might refer to it as relief pharmacists. The reason for this is obviously with the reduced operating hours, as I've referred to in the previous slide, permanent staff now kind of worked all the hours to comply with their contractual agreements. Also, with lockdown in place, permanent staff didn't take leave anymore, and as a result, no additional locum staff were needed to fill in for them during leave periods. Also, we were working with an infectious disease. So the risk of spreading the virus with temporary staff moving around from pharmacy to pharmacy, like working one day in this pharmacy and tomorrow they'll doing locum work in the next pharmacy, became a risk. And also there was economic uncertainty. So everybody was trying to reduce expenses because we didn't know what was happening. So on the next slide, I will elaborate a little bit more on the South African perspective. So PSSA conducted a survey to obtain a better understanding of the challenges experienced by our locum or relieved pharmacists during the COVID-19 pandemic. Because as you can imagine, all the factors I've mentioned in the previous slide impacted on locum or relieved pharmacists' opportunity to continue performing their work during the pandemic. So the aim was to find possible reasons and an explanation for the lack of employment opportunities. So in the PSSA, we have 877 members that works as locum pharmacists. So that is their, shall I call it, permanent choice of employment. So they're not fully or full-time employed in a community pharmacy or in a hospital pharmacy where they have employee benefits and employee contract, etc. So participation in the survey was voluntary, free, without, and they were free to withdraw from the survey. And this survey was conducted in May or early June 2020. So moving on to the next slide, there were certain criteria or special instructions. So obviously, as I've just mentioned, if you are full-time permanently employed by a single employer, this survey was not for you. And you were able or should be in a position of performing locum or relieved pharmacist work or shifts, and that is how you earn your income. So in other words, this is not in addition to a full-time salary earning that you've earned elsewhere, and that you've just, perform locums casually, like 1 week in a month or 1 evening in the week or something like that. So locum work is your primary or only source of income. And then we excluded certain criteria of participants. So if you were full-time permanently employed on 27 March 2020, when lockdown commenced, or who perform locum work, as I said, after hours in addition to a full-time employment, then also the survey was not for you. And we had that 200 participants completed the survey, which is about 22, almost 23% of our study population. So if we start looking at the results, just in a nutshell, the demographic information is that most of the participants were from the 3 major urban areas in South Africa, which is Gauteng province, KwaZulu-Natal province, and Western Cape province. So Chris, you can obviously see that the majority of the participants that suffer a change or a challenge during this time were from urban areas. And if we can see where they used to locum or perform their locum duties, it was in either corporate community pharmacies highlighted in green or independent community pharmacies highlighted in the yellow section. So if we move on to try and understand why there was a cancellation or whether there was a cancellation, 73% of our members or the participants indicated that they had booked locum work or locum shifts cancelled. And you can see in the graph there that it differs from 100% of income that they've lost down to 25% of their income lost. So majority of the shifts were cancelled within a week or two from going into lockdown. And the reasons that the participants indicated for why they think their shifts were cancelled is obviously that we went into lockdown, and I've elaborated on the reasons in earlier slide. The economic situation and the luxury of locum staff that was not affordable to owners at that point. Permanent staff not taking leave or off days, so there wasn't really a shortage of staff at that point in the workplace. Trading hours reduced, and then obviously also with everybody that went home and that was stuck in their homes in terms of the public or the patients, so people not actually coming into our central business districts of the bigger or the larger cities, pharmacies that were located in these areas also had a reduced level of patients visiting them, which also obviously impacted on the business that pharmacy performed themselves. So on the next slide, in South Africa, we have an unemployment insurance fund that it's driven by the Unemployment Insurance Act. And this is mandated by law that in certain circumstances, employees will make a monthly contribution via the payroll system to this fund. And this fund is obviously aimed at giving you or sourcing you with an income in case you are unemployed due to reasons other than resigning from your workplace. So our members indicated that a slight majority of the participants contribute to this fund. In other words, when they perform a locum shift or are remunerated for locum work performed at a pharmacy, there's a contribution that's subtracted from their remuneration, which is paid by the employer or the locum agency, and that is paid over to the insurance fund. The reason why it's only a slight majority, as I've mentioned, there might be other reasons why you do not contribute to this fund. So there's reasons in the Act that exclude you from contributing, or then it might be that you are remunerated in cash and not as such go through the formal process of remuneration through the employer, etc., etc. However, of this majority that do contribute to the fund, most of them did not submit a claim for financial relief when COVID commenced and when the hard lockdown commenced. And they've also mentioned that they were not contacted by their employer or the locum agency for who they work in regarding their eligibility to apply for financial relief through their employer to this unemployment insurance fund. So this, Chris, is quite funny to notice, because that is the aim and the purpose of this fund. And it's really hard to see that colleagues were not aware that they could access this opportunity, for which they maybe have contributed 30 years while being employed. And now that they actually have an opportunity to access this fund, they were not aware of it, or they weren't granted the opportunity. So moving on to the next slide, we also asked the participants whether they would appreciate some sort of guideline document for part-time or locum or relieved pharmacists to maybe guide them, because as we can see this type of fragile situation that they find themselves in, within a week or two, some of them lost 100% of their income in an industry that actually were considered essential during a lockdown. So it was strange to see that less than half of the participants actually indicated that they would benefit from such guide. So although majority lost up to 100% of their income, they were still not really interested to know maybe how they could avoid it in future, or how they could prepare themselves better in future. The 48% that did say, yes, we would like to benefit from a guide to assist us, indicated that the areas where they would like to have guidance on was, in the first case, and you can see it there right at the bottom, income protection insurance and unemployment insurance. As you can imagine, if you've lost 100% of your income and you would like to prepare better in future. We can also see that they would like guidance on taxation, personal income tax, pay as you earn or provisional tax, a personal emergency fund, or maybe advice on savings, and then also pension planning, annuities, and pension contributions. These type of things, Chris and colleagues out there, is for some things that are already in place, and for others, this was maybe the first time that they were confronted with things like this. If I use a personal emergency fund as an example, and I'm not sure about how it is perceived on the rest of the world, but in South Africa, prior to the pandemic, the normal guideline was that you should have 3 months worth of savings in an emergency fund in case of emergency. And then came COVID, and COVID wasn't over in 3 months. So I think it also learned us that what was the norm before COVID is maybe not the norm today, and that you should adjust, whether it's your savings, whether it's your pension, whether it's your income protection, to a much more disruptive environment, because COVID has shown us that life isn't what it was before. So if I can move then to the next slide, where we discussed then, and we've asked our participants, how could this unfortunate situation be resolved? Meaning, what could or should a body like the Pharmaceutical Society of South Africa do to assist our locum or relieved pharmacists in future to manage workforce demand in a pandemic? And there was really one comment that kind of sums it up the best way I could describe it. And that was a comment that say, it woken us up to the fact that we cannot rely on one income and we need to diversify. And Chris, this is really talking to my previous slide and that guide that we offered, and really there wasn't a majority appetite for something like that. What is a very important point that I would like to stretch is some of the other comments that our participants suggested, which they think is feasible suggestions. And I would like to comment on each of them in the interest of the fact that why they maybe isn't feasible suggestion. So firstly, one of the suggestions was that professional indemnity insurance, which we need to have in South Africa, should cover income during unforeseen circumstances. Now, if that was that easy, I think all of us would have it. Professional indemnity insurance is not there to cover income. It's not income protection. It's there to cover you in the case of an error. So the right answer would be to have income protection. That is the type of income that will cover you during unforeseen circumstances. Then the suggestion was that PSSI membership fee and professional indemnity insurance premiums should be relieved or should be waived. Of course, that is something that a body like PSSI could look at and could assist members in during a difficult time. They wanted more support to access the unemployment insurance fund or the temporary employer relief scheme. Again, that is something that should point to the employer, whether it's the pharmacy that they're locum for, or whether it's the locum agency through who they book shifts. But that is not necessarily the role of PSSA to support our members in. And clearly there is a miscommunication between the locum pharmacist and their employer when it comes to things like unemployment fund and temporary relief. There was also a suggestion for a centralized income protection. Again, we have something in place in South Africa, which is called Unemployment Insurance Fund. But if you look at the centralized income system, obviously you immediately think of the difficulty that comes with administrating a fund like that. And it would really just be easier if you take in your personal capacity responsibility to protect your own income and make provision for that. A centralized locum pool is a good suggestion to make sure that locum shifts is distributed equally, but it doesn't resolve the problem of, in an infectious disease pandemic, you don't want individuals to move between pharmacies and the opportunity to maybe spread the virus and infect different workforces in different pharmacies. And then the last suggestion was a bargaining council. And really a bargaining council that will talk to tariffs and remuneration and bargain for income. I don't think that was a solution for the problem that we had during the hard lockdown of COVID-19, because all the factors that led to the unfortunate situation that our locum pharmacists experienced was nothing to do with the lack of a bargaining council and the existence thereof. So Chris, if I come to the end of my presentation and we move to the next slide, it was important for the PSSA to start maybe hosting activities that could support our members in financial planning and preparing better on a financial level for something like a pandemic going forward. So we did have a holistic financial planning series where you could see there was 8 episodes or 8 parts to it, where we covered really a large number of things that should be in place on a personal level and to make sure that financially you are better covered for in the unfortunate event of a pandemic. And we're also busy currently with a pilot phase of a young professionals program for our intern members to also sensitize them towards preparing themselves financially and setting themselves up financially to be better off going forward. So Chris, thank you very much. If we move to the last slide, yes, it's thank you very much for the opportunity, and I'm really looking forward in engaging with the audience in the Q&A box. Thank you.
Thank you so much, Marie. That was a very fascinating and a bit concerning presentation. Very concerning to hear locum shifts cancelled. I understand it was a very difficult situation. And you've certainly raised a lot of questions in my head from your presentation. I would encourage people to put their questions in the Q&A box. I'm sure there are lots in people's heads as well. We do rely on locum and agency staff to a certain extent in where I am at the moment, and they have been covering indeed for people who have been off work because of COVID-19. So they're an important part of the workforce. We would also like to hear from people if you have similar or case studies around workforce supply and demand and how the pandemic impacted on your country or indeed your area, what happened. We would be very pleased to hear about it. So please do share any case studies with us as well. So thanks again, Marit. On to speaker number 2, I'm delighted to welcome Chima Amadi, who is presenting a case study from Nigeria. Chima has experience working as an education and training personnel at the Pharmacists Council of Nigeria. He's also undertaken research on workforce and access to medicines at the National Institute for Pharmaceutical Research and Development. He's an FIP Global Lead on Pharmacy Workforce Policy, which is FIP Development Goal 13, and a member of the Faculty of Public Health in the UK, as well as a member of the International Leadership Association. So thank you so much for joining us today, Chima, and the floor is yours.
Thank you, Chris. Good day, colleagues. I'm so happy to be here and to share the perspective from Nigeria. So we're talking about the impact of COVID-19 pandemic on pharmacy workforce in Nigeria. So before I start, I would like to give an overview of Nigeria, because so that we have the perspective going into the program. So Nigeria is a country in West Africa with over 200 million population. And shortly before the pandemic, our data shows we have about 30,000 pharmacists serving 200,000 people. And out of that number, you have 64%, about 64% of that population in community pharmacy practice, and while the rest are mostly in industry and in hospital pharmacy, and of course in research and in academia as well. So, and before the pandemic, we had about 45% shortage of access to medicines, and 60% of all the medicines used in Nigeria are usually imported from other countries like India and China. Then about 40% is being manufactured within the country, produced locally. So that's just the overview of Nigeria. So let's keep that in mind to enable us. If you go to the next slide, please. So yeah, like I mentioned, we have different pharmacy areas of pharmacy practice. So with the hospital pharmacy, so during the pandemic, the hospitals couldn't produce or deliver pharmaceutical care to the patients due to the lockdowns, and patients being scared to visit the hospitals for fear of contracting COVID. So this led to hospital pharmacies not being able to provide pharmaceutical care like they used to in the past. And also this affected patients with essential needs, like talk about people with HIV/AIDS who come regularly monthly for their prescription refills. So the aftermath of that led to increased resistance to HIV cases across the country due to people not being able to visit the pharmacy and lockdown and fear of COVID. So, and also due to the high burden of COVID cases in the country and rate of hospitalizations, so pharmacists in those essential services were redeployed to the COVID isolation units to help support the workforce who are already overwhelmed in the COVID-19 isolation units. So this reassignment further created much more deficit in the wards or in the units where patients with essential services or those without non-COVID related emergencies, like you talk about the hypertensive crisis, the asthmatic crisis, or the diabetes, as the case may be. So that also led to increase in mortality rates among such patients in that category. And of course, so for the pharmacists who have now been deployed to the COVID-19 units, a lot of them had higher risk of contracting COVID. Many of them had COVID cases, they were hospitalized. And of course, and because of that hospitalization, the workforce further dwindled, and creating much more pressure and creating much more overwhelming of staff, mental health crisis, and of course, a lot of issues with the hospital pharmacists, especially in public public health institutions. Then again, for the private sector, like the private hospitals, so due to the overwhelming of the public health sector, so the cost of healthcare rose, and because COVID created such a financial strain on the public and in the residents of the country. It created much more issues with catastrophic payments for health. The out-of-pocket expenditure during that period increased because obviously the public healthcare centers have been overwhelmed, and then people trying to go to the private sector couldn't necessarily afford them. So the next slide. So for community pharmacies as well, due to the increase in pressure in hospitals, we had a lot of those patients shifting to community pharmacies. And then we are also overwhelmed because the pressure is being diverted to them. There are increased rates of prescription refills, increased rate of people who had ailments that should be treated in the hospitals coming to the community pharmacies for treatment. And then this also led to overwhelming of the community pharmacies, more like a ripple effect or vicious cycle of shortage of staff. And the community pharmacies, all of them were testing positive and staying back home, and of course creating that much pressure on already existing in the country. Then of course there was high burnout rates of community pharmacists, coping with mental health, and of course the fear of contracting the virus. Ultimately, due to the shortage of medicines globally worsened by the pandemic, community pharmacies, some of them were closing because obviously if you can't provide medicines to the people who you serve, the community members, then of course the community pharmacy started closing down, some of them. And of course, this issue of workforce shortage was worsened by the mass migration of pharmacists to developed countries for greener pastures because of low remuneration rates compared to their counterparts like in the UK, in the US, and in Canada. So this outflux of pharmacists further deepened this shortage. Mind you, this migration has already begun before the pandemic. So its impact was much, much felt during the pandemic, as we also see in the next slide. Yeah, so for pharmaceutical manufacturing, in the overview, I mentioned earlier about the aspect of importation, where you have 60% of most drugs or medicines used being imported from China and India and other pharmaceutical producing countries. So due to the pandemic, the social amenities for pharmaceutical manufacture was also increased, like electricity. The cost of electricity was high. The basic infrastructure crucial to pharmaceutical manufacture was high. And the local industries were struggling to meet up to these high costs of production. And then since they import these raw materials from outside of the country, then there was also so much pressure on the foreign exchange in the country, whereby they couldn't access sufficient amounts to be able to import those medications or the raw materials or excipients into the country for manufacture. And then the COVID-19 pandemic obviously disrupted the supply chain of everything, including pharmaceuticals. And this disruption even made those raw materials unavailable for use in the country because, for instance, India was coping with their own pressure. So they also need those raw materials they're exporting. So they even kind of put some embargo in the exportation of their APIs for use within the country. So this also affected developing countries in Africa like Nigeria. Then, due to these scarcities, local pharmaceutical industry started shutting down as well. As we see in the next slides, how it affected pharmacy education as well. So we normally say that pharmacy students are the future of pharmacy practice because they are the ones that will come in and take over and impact the pharmacy profession in the country. So during the pandemic, we had shutdown of schools nationwide, tertiary institutions, including pharmacy schools, on respect to the lockdowns. So pharmacy students, we are forced to stay home, not going to school and not learning. And of course, this impacted the mental health of students, not being stuck at home, and not really doing. Although some of them tried to learn other skills, trying to acquire more knowledge on their own, which was quite tedious because of the internet divide. So students accessing internet was also a challenge during this period. And then because of the mental health issues and the closure of schools, students couldn't prepare very well for their exams. And due to this pressure also led to substantial poor performance in their examinations compared to previous years. And then like the final year students in pharmacy schools who recently met the criteria for qualification were not able to be officially inducted or licensed to practice because there was lockdown and they couldn't have such licensing during that period. Then for the continuous professional development programs, which is normally done for both the pharmacy technicians, the pharmacists, and of course the recently graduated pharmacists in the country, they are all postponed indefinitely, some of them, and because of the lockdown, and this further created the competency level or the inability, deficits in the ability of pharmacists to update their knowledge to be able to profile and to provide adequate services to the community that they serve. Next slide, please. So now that we've seen what the challenges and where the what's happened in terms of the negative implication, so we also want to look at how these facets of pharmacy practice responded to these challenges to be able to ensure that the community they serve have adequate healthcare. So for the government, they tried the federal government instructed the central bank to ensure provision of foreign exchange for pharmaceutical companies to procure raw materials. So there was kind of a special intervention for pharmaceutical companies to have access to those foreign currencies to import their raw materials for manufacture. Then there are also financial incentives to pharmacy workforce in the civil service, just as a means of motivating them to continue doing what they do to ensure people in the community have adequate pharmaceutical care during that period. These incentives range from monthly stipends, especially for those in the civil service, like in the hospitals, and giving them some relief. And also the government also created off days for those, normally before now, those in the civil service work full-time, like Monday to Friday all through. So they created alternate days for them to come and stay back home so that to be able to cope with the mental health burden that the challenge has produced for them or has impacted them negatively. Then, of course, they recognize that pharmacy workforce as essential health services. So one striking thing is the recruitment of some retired health professionals into the health system to support the already overwhelmed staff, the already overwhelmed pharmacists in the sector, to help boost the workforce. And the government also provided funds to encourage research among pharmacists in academic and the research institutes, because the government realized that obviously due to the disruption of global supply chain, there is need to boost local production, there is need to boost research to see if those APIs and those excipients can be manufactured within the country instead of getting them from abroad. Then before now, some of the hospitals in the country do not make extemporaneous preparations like in the hospital facilities for patients. So this was reactivated to ensure that, to also create a local product, manufacture of local products in the hospital for local use within the hospital and the other facilities. Then due to the shortage of PPEs, the government also engaged the services of lots of people outside the health sector, like for example, for face masks, engaged like those who produce the fashion designers to help produce these PPEs locally for use, because there is high cost of already imported PPE and even scarcity of them, even if they are being found. Next slide, please. So the pharmacy associations also responded positively. So we saw different pharmacy associations like the PSM, Pharmaceutical Society of Nigeria, Association of Hospital and Administrative Pharmacists, engaging in the production of face masks and hand sanitizers. They did this by sourcing for hand sanitizers, API locally, like alcohol, locally made alcohol and everything, to be able to manufacture these products. But obviously, before the products were used, it was ensured that they passed through the regulatory agencies for approval to satisfy their safety and to satisfy that they meet the basic standards as stated in the official books. So pharmaceutical associations also engaged in healthcare trainings for pharmacists in the country to boost their knowledge on how to protect themselves and on how to ensure that their people they serve are also protected. Then this pandemic also made the associations to liaise and collaborate with other health associations. For example, you have the PSN liaising with the Nigerian Medical Association, liaising with the Nurses Association, whereby they can come together to advocate for the government, more government intervention, the protection of the health, the interests of the health workforce in the country, to ensure that their needs, their wants are communicated and adequately addressed by the government. So also they engaged in advocacy for use of community pharmacies as COVID-19 vaccination centers. This wasn't the case before, but due to this advocacy, it was positive and it was actualized. Next slide, please. Now, for the Pharmaceutical Regulatory Agency, they also try to address the needs of pharmacy students who are at home and who include even those who couldn't be inducted into the profession after meeting the requirements. So there was high usage of e-learning platform for training. So some pharmacy schools across the country were encouraged to use the e-learning platforms to educate, to pass knowledge across, and to lecture students while they're at home during the lockdowns. But obviously, it was impactful, but not 100% effective due to the poor access to internet and also the high cost of it, of which some students couldn't afford. But it went a long way to ensure that some students at home were able to acquire knowledge while at home. Then for the continuous pharmacy trainings were also done online because so a portal was created whereby those notes, maybe lecture notes and trainings, recordings were uploaded for pharmacists and the pharmacy technicians and other pharmacy related workforce to access, to boost their knowledge since excuse me, they couldn't do that in person. So the regulatory agency also did one remarkable thing. So by pre-licensing those recently graduated students, that is those pharmacy students who have met the requirements to be inducted, they were pre-licensed. With this pre-licensing, it enabled them to move on to go ahead for their internship spaces, to look for internships and move on with their career while awaiting the official induction ceremony. With this, this move helped to boost the health workforce because students coming out who have met the requirements, who have the knowledge, but because of the lockdown, they are not able to. So the pre-license helped the students and gave them the legal authority to move in and help come into the sector and help the profession as well. Then online inductions were created, was also done, whereby normally inductions are done in person. So in this period, some inductions were conducted online, whereby the qualified students come online and we are inducted. But that was after the pre-licensing. COVID, the pre-licensing was done during the first and second waves of the pandemic. So, but when the pandemic subsided, then the interviews, the inductions were done online for the students. Next slide, please. Yeah, so for the community pharmacy, there was high adoption of telemedicine and e-pharmacy platforms. This is because to reduce patient community pharmacy contacts, in-person contacts, because the in-person contacts created lots of ensured that the pharmacists in those community pharmacies tested positive. So to reduce the rate at which community pharmacists would test positive for COVID. So telemedicine and e-pharmacy platforms enabled patients to interact with their pharmacists through digital gadgets like their phones. Remarkable, some community pharmacies use Twitter as a platform to communicate with their patients. on social media platforms, and there's also some special platforms that are created. And then community pharmacies as well work closely with logistics companies to ensure that patients' medications are delivered to them in their homes instead of pharmacy working prescription refills. So they got their medicine delivered to their homes, and they work like in partnership with some logistics companies like Coca-Cola and other UPS to ensure that these medicines get to the last mile timely. Then, obviously, pharmaceutical care entails one-on-one and face-to-face counseling. But due to the pandemic, community pharmacists switched to window dispensing. Yeah, this wasn't so pleasant because of the face-to-face counseling. But then again, it helps to reduce the extent at which community pharmacies will test positive to COVID-19 and other related ailments. So some community pharmacies as well ensure that their patients get screened if there's essential need for them to work in, that will ensure that they don't have COVID, or they're not exhibiting symptoms of COVID. They do this by putting hand washing measures at the entrance of the pharmacy, and ensuring that they can check their temperature at the entrance. And also, if conduct, because during this period, there are locally manufactured COVID test kits, which was being used by patients before they could come into the pharmacy. And then those who have symptoms of COVID are referred to hospitals even before they have contact with the pharmacist. The pharmacists also engaged in education of the patients on how they can recruit, how they can prevent COVID and stay safe. Then again, intel pharmacies were recruited more, like the recent graduates I mentioned earlier in the earlier slides, and people who normally, before now, community pharmacies don't usually recruit more intel pharmacists. But during this COVID-19 pandemic, they had to recruit more pharmacists to fill in the workforce shortage in the country. Next slide, please. So thank you so much. Really good to be here. And I look forward to your questions in the Q&A section. Thank you so much. Back to you, Chris.
Thank you, Chima, so much. That's a very fascinating look at how Nigeria faced some of these enormous challenges that the COVID-19 pandemic presented. And it was really interesting to see the workforce supply issues alongside the medicine supply issues. Okay, moving swiftly on to our third speaker, I'm delighted to welcome Professor Rula Darwish, who is joining us today from Jordan. Rula is a member of the International Advisory Group in the Accreditation Council for Pharmacy Education. She's a member of the Executive Committee of the FIP Academic Section and chair of the Continuing Professional Development in Jordan. She's chair of Continuing Professional Development in Jordan at the Jordan Pharmaceutical Association. She's FIP Global Lead for Development Goal 9, which is about CPD, and she's a member of the Advisory Committee of the WHO for Tailoring Antimicrobial Resistant Program. So thank you so much, Rula. The floor is yours.
Thank you, Chris, and good morning, good afternoon, and good evening, dear colleagues. And thank you, FIP and Chris, of course, for giving us this opportunity to give a glimpse of Jordan experience in the aspect of role of pharmacists in vaccination. Can I have the next slide, please, Chris? I'll give you just a briefing about Jordan. It's a small Mediterranean country with a population over 10 million, with many ethnic groups and a young generation in general. Next slide, please. So in regard of vaccination, actually Jordan is considered a leading country in providing essential vaccines. We have what we call National Vaccination Program, which is responsible for around 95% of child vaccination as part of the Ministry of Health sponsored free programs. So it includes many vaccines, including MMR and many others. Now with COVID-19 pandemic, this dictated upgrading of national healthcare system to expand the scope of immunizers. Next slide, please, Chris. If you look at the situation in Jordan, it has been reported more than 1.5 million confirmed cases of COVID-19 with 14,000 deaths up till now. This was reported to WHO. Next slide, please. Now, there has been some changes in national vaccination campaign in Jordan, but in general, it is carried by the Ministry of Health and the National Center for Security and Crisis Management. And here, many regulations have been changed where any individual in Jordanian soil is eligible to receive vaccine and it's free of charge. And however, it's not mandatory to have the vaccines. Everyone is encouraged to receive the vaccine, especially the elderly ones, and they are encouraged to register to receive the vaccine in certain platform. And the PCR is also very essential for those who were reluctant to take this vaccine. Next slide, please, Chris. Now, that means if you look at this graph here, figure here, you can see that Jordan has administered at least 10 million doses of COVID-19 vaccine so far, and that means 50% of the country population has been vaccinated. Next slide, please. Now, as you know, for good health, it is essential to sustain development and thus make plans for sustainable in regard of vaccination. So that's why different approaches has been taken by Jordan, which is using different types of vaccine, allocating budget to ensure supply, and very importantly, is train the healthcare providers from different sectors, including pharmacists, of course, on best practice and immunization. And this challenge has given an opportunity for the pharmacist to become an immunizer, and I'll come to this a little bit later. Also, awareness campaigns were launched, and very importantly, scientists were encouraged and manufacturing to work on vaccine as products. And this, as you know, pharmacist duty in our countries. Next slide, please. Now, very important is to allocate the weaknesses and challenges. As we always say, once you allocate the weakness and challenge, this is going to give opportunities to improve. And one of the major weaknesses in Jordan is the availability of the vaccines. As you know, Jordan is a middle low income country. That means sometimes they cannot purchase enough quantity, if you like, of vaccination. The other thing is pharmacy industry. Pharmaceutical industry in Jordan is considered a strong sector. However, production of vaccines are not their priority. And this is maybe due to logistic and high cost of production. Also, difficulty in following different stages of clinical trials, in addition to intellectual property burden. The other challenge is resistance to vaccination among public, and so, not even the normal public, but also healthcare workers and academicians. They were resistant to some extent to vaccination, and this can be a barrier to proper vaccination among community. Lack of trained medical personnel, including, again, pharmacists, and inadequate health infrastructure to limit, this led to limited tracking mechanisms. Lack of involvement of different healthcare professions in vaccination, and also, very importantly, educational programs in different health schools were not adequate to produce cadre competent for vaccination. Next slide, please. So it's really obvious that empowering pharmacists is very important. Pharmacists, as we all know, are well-suited healthcare immunizers, and after proper training and certification, they can be a good asset for immunization. And they have also strong relations and accessibility to their local community. Pharmacists are also experts on vaccines and the mode of action, the effect of onset, drug-drug interaction, side effects, and pharmacokinetics. as well as their other administrative roles regarding vaccination, like vaccination supply and proper storage conditions. Actually, if you look at the literature, you find that literature support the role of pharmacists as immunizer to increase effective vaccination rate. And of course, consequently, it's going to reduce the likelihood of unnecessary vaccine preventable infections. Pharmacists can contribute also to disease prevention by acting not only as immunizer, as educator and advisor and facilitator, and also he can or she can facilitate and participate in national and global routine immunization initiatives. And all these competencies are being highlighted in pharmaceutical education. Next slide, please. So if you look at the Jordan Pharmaceutical Association, they made like collaboration with FIP, and they have signed what we call the Amman Commitment to Action on Primary Healthcare. And that mandates transformation strategies and program. Jordan Pharmaceutical Association formed vaccination committee to follow up with all the stakeholders to adjust legislation to enable qualified pharmacists to administer vaccines. Also, many awareness and educational workshops has been given to pharmacists. And these many workshops and training were done to enable pharmacists administer firstly flu vaccine, and then they expanded to COVID-19 vaccine. So also many vaccination campaigns were conducted by a group of pharmacists to the elderly in nursing homes. Next slide, please. In response to all this effort, we find that new legislation has been formed and influenza vaccination can now be administered by pharmacists in Jordan. However, pharmacists need to hold a certificate from JPA confirming their competency to vaccinate, and also their pharmacies themselves must be registered by Jordan Drug Food Association. Now, with availability of COVID-19 vaccine, pharmacists were trained for administering the vaccine, and I'm going to talk about this shortly. Can I have the next slide, please? Now, to prepare the pharmacists for their role, it's actually very important to prepare pharmacists for the new roles that it's being, as you know, the role is being transformed all the time. So training not only on how to deliver the vaccine is done, but also knowing how to deal with adverse effects if it happens. That's why the training, the CPR training is required, and also first aid training is required for the pharmacist who's going to be to act as an immunizer. What happened during COVID-19, more than 1,500 pharmacists were further trained by Ministry of Health and were involved in vaccinating the population. As for the Jordan Pharmaceutical Association, as I said earlier, they worked on this issue even before COVID-19, but with COVID-19, this was enhanced. Jordan Pharmaceutical Association made several workshops and published also guidelines to vaccine, and this is very helpful for any person, any pharmacist who's going to pursue his career or to pursue immunization, and have approved pharmacists for Ministry of Health to be accredited to get vaccines for public. Next slide, please. So what happened during COVID-19? A major role was played by Jordanian pharmacists during this pandemic. Pharmacists contributed in decreasing community transmission by increasing public awareness towards COVID-19 disease among the general population. And this was done through either counseling or referring or avoiding panic. Not only that, but also direct intervention through vaccination was provided by pharmacists. Pharmacists actually volunteered in vaccination center where they administered vaccine, made sure the storage conditions was right, quality assured the administration of vaccines, and also were involved with the population giving advice and counseling whenever needed. And this has improved the acceptance of public for pharmacists becoming a vaccinator. Next slide, please. We actually did several studies on from different points of view. We talked for the public in regard of their idea about vaccination and the role of pharmacists as being a vaccinator. And we also took the study from the other side, where we talked to the community pharmacists and see their opinion on becoming a vaccinator or immunizer. So the first study was done on the population, and we were looking for assessing general perception and attitude of the public on vaccine current practice and pharmacists as being immunizer. The sample size was 366. And very importantly, that the study was national scope, not only in the capital, but also it went to the referral parts of Jordan. And as you can see from the graph here, the difference and response rate in willingness to accept pharmacists as immunizer services among participants before and after certification. Next slide, please, Chris. So if you look at the study findings, we find that respondents represented from Jordan support the role of vaccination as preventive tool. And this is a very good step, because they are aware of the importance of vaccines. However, they think that current vaccination system in Jordan need to be revised again and improved to increase vaccination effectiveness. Very importantly, we find that respondents highly support the idea of allowing pharmacists to become immunizer. However, they were concerned, as you have noticed from the figure before, regarding training. So they insisted on the pharmacists being trained and certified, and the facilities should be also up to the standards. All in all, under the current circumstances and based on the data, researchers of this manuscript support expanding the scope of pharmacy practice in Jordan to include pharmacists being an immunizer and becoming an essential, playing an essential part of the community pharmacy's point of care services. Next slide, please. The other study, as I mentioned, was concerned with the community pharmacist workforce readiness to deliver vaccination. And this was, again, targeting practicing community pharmacists. Total of 403 community pharmacists participated in this study. We find that around 1/3 of them were reported vaccinating patients in their practice sites. However, unfortunately, readiness assessment revealed that only 13% pharmacists received the required training and qualifications. And if you look at the figure, please, next, Chris. They insisted that they need Jordan Pharmaceutical Association support and also the Ministry of Health support in order to act as an actual competent immunizer. Next slide, please. So this study focused on that delivery of vaccination services in the community pharmacies is based on 4 pillars, as you can see from this figure. The first one is trained and qualified pharmacists. The second one is pharmacies and supply chain suitability and patient acceptance. The third one is the patient acceptance. The fourth one is support from regulatory bodies. And all of them, all these pillars influence each other. And it is necessary to ensure safe and proper delivery of vaccination services in the community pharmacies. So this study actually revealed that future work is needed to increase pharmacists and pharmacies' readiness to deliver vaccination services. And regulators should follow a more active approach in highlighting the importance of training and impact of training in patient safety and satisfaction. Next slide, please. So what we conclude from this, in what is needed now, is to work actually on different levels. The first level would be the policymakers themselves to provide proper legislation that allows the certified pharmacists to become immunizers if they fulfill the requirements, of course. Jordan Pharmaceutical Association, this is another level that should deliver proper training and certification for pharmacists to be able to practice as immunizer. And this can be done through continuous professional educational and continuous assessment. School of Pharmacies themselves also need to emphasize more on theory and practice of vaccine in different courses. Public education is very important. it should emphasize on the role of pharmacists as part of the healthcare providers that can apply vaccines. Pharmacists themselves should have the proper competencies and prepare their pharmacies to accommodate vaccination. Next slide, please. So during COVID-19, we can say Pharmacist has a success story in Jordan, and they prove that they are qualified and have high degree of professionalism. And it's clear that pharmacists can play a central role in encouraging COVID-19 vaccination. Actually, educating pharmacists and achieving high vaccination coverage level of healthcare workers in general, including pharmacists, ensures an adequate workforce to treat infected patients and also allow medical authority figures to share their positive vaccination experiences with patients. So another thing, we should work on different levels, as I just mentioned, including policymakers, schools of pharmacy, public advocacy, pharmaceutical association, and pharmacists. This is the key of success. Next slide, please, Chris. Now, thank you very much for listening, and thank you for the opportunity again. And I'm waiting for your questions in the Q&A box. Thank you.
Thank you so much, Rula. So wonderful to hear that success story of the role of pharmacists in immunization in Jordan. And for those people from other nations attending today who would want to advocate for the role of pharmacists in immunizations, particularly COVID-19, then you've got a brilliant case study there to look at as to how to achieve that. So
thank you, Chris.
Okay, to our final speaker, I'm delighted to welcome Dr. Barbel Holbein, who's joining us from Germany. Barbel's a community pharmacist, as well as lecturer and researcher in innovation, access to innovation and global health topics. She's also a lecturer in residential care homes on clinical geriatric pharmacy, as well as being a FIP global lead for Development Goal 7, advancing integrated services, and Development Goal 11, which is outcomes and impact. So without further ado, I will hand the floor over to Barbel. Welcome.
Thank you, Chris, and hello around the globe. Thank you for having me here. It's really a pleasure to me to talk to you, particularly in times of the German G7 presidency. Could you give the next slide, Chris? Yeah, thank you. So I'd like to give you some insights into the current situation, and we'll spend a few minutes on the understanding of the challenges regarding pandemic preparedness and the pharmaceutical workforce. And I'm sharing with you some thoughts on transformation and healthcare system in the pandemic and beyond. So the next slide, please, Chris. Thank you. The OECD confirmed Germany a strong health system and a robust pandemic response. And let's have a look into the German situation. As everywhere, the pharmaceutical workforce, from owners to employees, suffered from the workload and the working conditions. 160,000 pharmacists in around 18,500 community pharmacies serve 3 million persons per day, and this in a fragmented landscape of pharmacies. In the first shutdown, 4 million liters of disinfectant were confected and provided. And between December 2020 and April 21, 400 million face masks were dispensed. By today, our colleagues wrote 100 million certificates of vaccination and immunization. The same amount of vaccine dosage were dispensed, which corresponds to 75% of citizens that have a basic immunization. 4,500 pharmacies offer antigen tests free of charge for citizens. And coming from a pilot project in influenza in 2018-2019, German community pharmacies have been trained intensively in the spring on vaccination, and around 1,000 pharmacies vaccinate by now. The medication delivery increased by 50%. So the next slide, please. Like worldwide, the current situation is dominated by the inflation, the recession, and the war in Ukraine, with anticipated consequences, including energy shortages and supply chain disruptions. There exists a financial gap in the healthcare system, and our colleagues worry about the increasing cost pressure and cost cuts. The outlook for the community pharmacies and their profits is forecasted to further decline, followed by a further close down of pharmacies and a respective reallocation. The owners fear for further salary increases triggered by the inflation and increasing payments to the health insurance system. The next slide, please, Chris. Thank you. As everywhere, the working environment has changed with extra work and high workload. My colleagues mentioned it earlier. We were guided to work shifts and face an increasing need of flexibility and higher complexity here, as everywhere, I think. As in other branches, we anticipate an earlier retirement by employees in the future. And this is interesting because our governmental expert board for health recommends a later retirement in times of a demographic wave. We can observe a first cut down of working hours by employees. And pharmacy owners do not exclude to shorten the opening hours. The German pharmacy workforce feels fatigued by the tsunami of regulations coming on a daily basis, and they miss a proactive handling. Regarding supply chains, we experienced already before the pandemic shortages due to the rebate system. And for the time in the pandemic, the handling of these shortages was calculated to absorb 10% of the working time. As of last week, community pharmacies can provide additional services like medication management, counseling in certain disease areas, and vaccination. And we are trying to get more digitalized. This means we are in the process of introduction to introduce e-prescription and e-patient dossiers. By the way, a small group of colleagues offer the training in telepharmacy, but this is not yet really a topic for our daily work. The next slide, please. So how do we translate this into future preparedness? Yeah, there's first the entrepreneurial culture. To attract and retain the staff members, owners work on their employer branding, and in case of contract terminations, they try to live an appropriate offboarding. And of course, vital became communication, including crisis communication. So the imperatives are communicate, motivate, involve the staff, take care of their health status, their mental health status, take and give clearance, give free space, discretion, and tolerance for decisions to make. Give an outlook, share the outlook with them, develop various scenarios and communicate them, or better, develop these scenarios together. All together means this, and also to avoid mental health issues. In times of remote work, also pharmacy owners have to think about new working models for their pharmacies, including hybrid work. Colleagues of mine discuss valuing the pharmaceutical workforce through the system by tax reductions, but this without competition between the counties and between countries, and also globally. Shima mentioned this earlier. And of course, we should avoid health worker migration. Education can be another one in valuing the pharmaceutical workforce. For preparedness in times of an accelerated transformation, the entire planning of the business, the adaptation of the business model, which leads also to an educational topics and the question how the business is integrated in the community has become more and more essential here. The next, Chris. Thank you. So what did we learn globally and how can we translate those lessons? So we learned about collaboration. We need to work interprofessionally instead under stupid competition, particularly between the different disciplines, and particularly with the background of an aging population and the shortfall of health workers. To me, expertise and access to expertise translate into education also for patients. Health competency comes together with patient attraction and patient engagement. Equitable access means person-centered and further counseling on an individual level. Pharmacists has demonstrated again their permanent accessibility and reliability and should be valued as an integral part of the healthcare system. We heard that from our former speakers too. And on a global level, experts discuss reframing and refinancing healthcare systems, which offers opportunity on a national level. And I'm quite optimistic, thanks to OECD conference between finance and health ministers end of May. In order to drive reforms, I'm convinced that we need further pharmacy practice research and additionally health service research for data generation on patient outcomes and on a variety of health economic and economic numbers, including health worker labor market numbers. The next slide, please. Thanks. Yeah, and how do we experience and discuss the response and the future pandemic preparedness in Germany? It is part of the transformation we are living in. It is common sense here that it's rather a system question and task. The thoughts regarding healthcare systems are the following: reframing and rethinking, the involvement of communities. There are study results of our Bertelsmann Stiftung, rethinking and valuing the pharmacy profession with its diverse knowledge and skills. And there are voices on closing the evidence gap, which means to us to demonstrate our contribution with the research I explained. A department in the Health Ministry reflects the need and issue of further competency building and education. The next slide, please. Yeah, here I'd like to take the opportunity to draw your attention to the DG11 impact framework, which offers also guidance for future research. My colleague Judy Nido did an incredible work, so thanks to her. Later, Pascal Salamé joined the team, and I'm lucky to work together with them. So the next slide. Thank you. Regarding transformation and education and transformation, to me, it's obvious to follow the one FIP approach and the FIP development goals. Future skills and knowledge include technological and social innovation, leadership and management, basics of advocacy, and understanding of new work, business models, and better knowledge on healthcare system and the dynamics in the market. One Health and health as a public and common good should be part of the curricula and the CPD. The next. Thank you. I come to the system approach I mentioned earlier. There is a need, and there is an urgent need, to value the pharmaceutical workforce in promoting health, preventing illness, and treating diseases with their diverse expertise. We live our contribution in universal health coverage. We have an impact on the innovation in access. We play an important role in engaging patients. We have a value in the system. We demonstrated it and continue to do so in this pandemic. And we have an impact on health as a common good. I'm convinced by that. And this brings me to the last slide. I tried to give you an idea of the German journey through the transformation and the pandemic, and I'd like to conclude or summarize with a question and a call within different levels. So first, what do we as community value, and also globally? What is of value for us regarding health? To me, this includes thinking away from spending and cost towards investments for a public purpose within a government approach, and health as a common good, and this globally. I strongly believe in the urgent need to reposition the pharmaceutical profession and the pharmacy, the workforce, as a reliable stakeholder in a monopolistic market, and this will be really challenging here, particularly economic-wise, and with new rebate contracts on the German horizon. Make the working place attractive and do your homework. And then lastly, my call to colleagues, and even in your micro environment, don't miss to co-design the transformation and be part of the transformation with focus on your staff. Thank you.
Thanks so much, Barbara. That was a very fascinating look at how, and important look at how we prepare for future pandemics, what we need to do, what we need to consider, and certainly your word collaboration really resonated with me. That has been so important with dealing with the current pandemic, but our workforce is so important and we need them prepared for what will be coming down the line, which we don't know what that is yet. So thank you so much. And if people can, in the last few minutes we have left, do keep your questions coming. We'll try and answer them as within the question and answer box as we can. But as I say, we are drawing to a close, and I would like to thank our wonderful speakers, Marit, Chima, Rula, and Barbel, for their wonderful presentations. The case studies from around the world are so important for our learning as a global pharmacy community and for us to develop our practice and advance pharmacy. So thank you so much again. Just have a few announcements. We've got a pharmacy practice research summer meeting going on in the Netherlands from the 4th and 5th of July in Utrecht. So if you're interested in that, the information is on the screen and there's the link and QR code there for you. Reminder, this is very exciting. After a couple of years off, the 80th FIP World Congress of Pharmacy and Pharmaceutical Sciences will be taking place in Seville, the beautiful city of Seville in Spain, on the 18th of September through to the 22nd of September 2022. And the theme is Pharmacy United in Recovering of Healthcare. So the program topics at Seville are Never Waste a Crisis, Learnings for Future Preparedness. Topic 2 is Science and Evidence Supporting the Response to COVID-19. And topic 3 is Dealing with New and Extraordinary Ethical Challenges. The early bird registration deadline is 15th of July. You have a little bit of time, so get your early bird registrations in as quickly as you can. As I mentioned earlier, this event is recorded and will be available on our website at events.fip.org. So please do visit that website to also see what other events are on. We've got a range of very informative and useful events in the FIP events calendar this year. Finally, thank you all for attending. I hope you found it useful. I certainly have. I've learned a lot, and we will have another COVID-19 event on the 19th of July, and we look forward to seeing you there. Thank you so much, and goodbye.